Welcome to Lungs First, a podcast where we deep dive into solutions around lung health and lung cancer. In today's episode, we have Dr. Mubarakunnisa Tonse, a medical oncologist, a consultant of Cancer Mumbai. Hello, Dr. Mubarakunnisa. Thank you so much for joining us today. So my first question for you is that lung cancer is often associated with smoking. But can you elaborate on how tobacco-related carcinogens contribute to the development of lung cancer specifically?
Tobacco contains multiple cancer-causing substances called as carcinogens. These harmful chemicals, toxins, they damage one's DNA. Everyone must be aware about what's DNA. It's basic building blocks of life. So once there is a mutation in your DNA, the cells become cancerous. So these cells multiply and they become tumors. Later on, they spread to other organs too. So this is how carcinogens
Specifically affect.
And tobacco per se has more than 70 cancer-causing substances, cigarette smoking especially, and cigarette, that is non-combustible form, other forms of tobacco like chewing tobacco, etc., has lesser number, 37 or so, lesser number of carcinogens compared to the smoking tobacco.
Are there any non-smoking related risk factors for lung cancer that individuals should be aware of?
Yes, good question, because smoking is linked to lung cancer very commonly. Like 60 to 70% of the lung cancers are because of smoking. But there's other factors like air pollution, which is like now coming in limelight because of poor air quality index, which we are facing, especially PM particulate matter 2.5. Increased levels of them cause lung cancer, and exposure to radon. It's a naturally occurring gas which is seen in soil, and increased content of which in indoors. It can be bad. It's a carcinogen. It causes approximately 10% or more of cancers. And then household smoke, people, those who use non-traditional methods for cooking, biofuel, without those women who don't use chimney, etc., are they're prone to get lung cancer. And there are other risk factors like familial or hereditary lung cancer, which is very low, like probably less than 5% of lung cancers. And there are, newer things like mutation-associated lung cancer, which is seen in younger, non-smoker individuals.
Thank you. That's quite a vast number of factors from where lung cancer can just appear. Can you explain how the presence of these lesser-known carcinogens in tobacco products may differ across various types of tobacco, such as cigarettes, cigars, and smokeless tobacco, for instance?
Good question. Actually, people they think that smokeless tobacco is non-carcinogen, is like vaping, etc. It's not true. Though smoking tobacco has higher percentage of carcinogens and higher number of carcinogens, because you add certain things like additives to flavor them, and like combustible properties, etc. But smokeless tobacco, like chewing tobacco itself, also has a lot of carcinogens. And the newer concept like e-cigarettes and vaping, this does contain carcinogens, but not specific ones which are there in tobacco, like cigarettes, etc. But it has newer other carcinogens like acrolein, etc., which are documented to be carcinogenic, and more research is coming up in this field. So we don't have a lot of evidence for now, because these are new things, new products. So WHO and other institutions or organizations are conducting research and coming up with newer data. So definitely it's not safe. Vaping or e-cigarettes are not safe.
We don't have a number or a percentage or a particular term to what it is doing, but it is definitely not on the upside of.
Yes, it's not safe because it does have carcinogen, though not what is found in the traditional cigarette or chewing tobacco, but it does have carcinogens.
Okay, moving on. Are there any specific demographic groups or populations that may be particularly vulnerable to the carcinogenic effects of tobacco? And if so, what are the factors that contribute to this increased vulnerability?
So, per se, carcinogenic effect, I wouldn't call it. Yes, vulnerable population, somebody who has a familial history of lung cancer, somebody with the genetic inherited risk of developing lung cancer, they will be definitely at risk of getting lung cancer due to smoking. Apart from that, there is a vulnerable population like young and adolescent people who, when exposed early to tobacco, because tobacco contains nicotine, which makes them addicted to the substance, and so these people are found to consume tobacco-related products compared to the older population, and people who are having psychiatric illnesses, anxiety disorder or depression are more prone for substance abuse, and those who deal with other substance abuse like alcohol consumption and other things, they are also prone to consume tobacco. So these are the vulnerable groups. And people with research has also found that people with lower socioeconomic background, they tend to indulge in tobacco as compared to ones who have a good educational background, etc. Because you'll have less information about harmful effects of tobacco in that case.
Also, the demography sort of contributes to a certain kind of a coping mechanism also, I guess.
Yes. Coping mechanisms like young adolescent group or somebody with psychiatric disorders. So they perceive it as a coping mechanism, cigarette smoking or chewing tobacco as a coping mechanism to get out of certain mood, depression or anxiety, mood swings, etc. So their tobacco, the nicotine, the addictive component here, which helps them to cope up.
The next bit of question is actually about people who are teenagers, the adolescents, which is like a widespread problem right now, I think, in the country. How harmful is smoking at an adolescent age?
Very good question. Actually, what happens is that's when your habits are formed. You see your peers and you have friends who indulge in tobacco smoking or vaping, etc. And that's when one starts. So that's very difficult because nicotine addiction in adolescent and young adults, it becomes difficult to get rid of. Whereas when you're adults, when you start, probably it's easier to quit because nicotine is just, it's like screen. Screen addiction is very difficult in young children, adolescent, or even toddlers or school-going children.
It shapes your mind.
Basically, it releases dopamine.
Correct.
It's a neurotransmitter. It sort of releases dopamine and makes you feel good hormone. So whenever you consume these products, so you feel good about it, and it makes you get addicted. So you develop physical dependence to tobacco. That's why it becomes very harmful and vulnerable for these populations.
What are a few reasons why someone smokes?
As I said, in young adolescent group, it's peer pressure. You see your friends smoking, you have a group, you have friends who indulge in these substances, and you indulge too. That's most common reason for these age group to get into tobacco or other substance abuse. Then other things like, people feel that it helps you concentrate better, tobacco smoking, but it's not true. What happens is it makes you addicted to nicotine, and when you are away from cigarette, the nicotine withdrawal, it causes withdrawal symptoms like agitation, etc. So the minute again you have a cigarette, so these symptoms settle down. So that's when you feel that I'm able to concentrate better, etc. And then you go on smoking. People who have psychiatric illnesses, so they feel that their moods, their episodes of depression and anxiety, they get well controlled with a substance. So they generally indulge into either alcohol or tobacco to, cope up with these mood swings and other anxiety issues. And there is like craving for tobacco. That's because you're already once exposed that causes you to again go back to smoking.
What are the consequences of early tobacco exposure?
So there are a lot of changes which happen in your body when you are exposed to cigarette smoking. Each and every part of your body is, affected by cigarette smoking. So most commonly, your lungs are the prominent organs because that's where all the carcinogens cause inflammation, and you have lung disease, chronic obstructive pulmonary disease, COPD, emphysema, where patient has chronic cough, breathlessness, requires multiple episodes of admission, has low saturation levels. So then in your blood becomes thicker because of smoking, and then you can have blood disorders called as polycythemia. Then also it affects your heart in multiple ways, like you can have increased risk of getting a heart attack or myocardial infarction. Not only that, you also have increased risk of getting a heart failure, right heart failure, because of smoking and changes in your pulmonary circulation. And then definitely cancers, it's like there's so much increased risk of cancer. There are 17 different cancers which are directly linked to cigarette smoking, most commonly lung cancer, followed by pancreatic cancer, cancer of the
Mouth.
Oral cavity, mouth, head and neck in general, pharynx, larynx, your food pipe or esophagus, and stomach cancer, cervical cancer, and acute leukemia, blood cancer. So, cutting down on smoking definitely
Helps.
yes.
Of course.
And this is just to mention few. Then there are other effects on your, kidneys because of long-term inflammation, etc.
What is the right way to quit smoking?
So you need to be under, help. You cannot do it. I mean, if somebody has been using tobacco for a long time, so it's better you consult a doctor, and you will be placed on medications, to reduce the craving for nicotine. Nicotine replacement therapy in the form of chewing nicotine or nicotine patches are available.
Yeah.
In fact, there are medications also available called, bupropion, etc., which helps you to reduce the craving, withdrawal symptoms associated with tobacco. So the withdrawal symptoms can start anywhere from a couple of hours to they can go on up to 4 weeks. So in this period, one needs to be aware about the surroundings, avoid certain triggers like maybe ashtray, things which make them, remember the smoking
Like a small
incident.
trigger you look at and you're like,
And then like lighters, the group of people you are with, like your peers, your colleagues in office, etc., whom you hang out with during breaks. And then probably deep breathing exercise. I guess that's very
very essential.
and it helps you to reduce the stressor levels, it helps you to calm down, bring down the withdrawal symptoms, etc. So exercising in general can help you with withdrawal symptoms and get you out of nicotine addiction. Also, like instruments like fidgeting instruments to hold on in your hand instead of a cigarette,
Yeah.
and chewing something like a gum or a hard candy which do not have high glucose content. Maybe all those will help instead of having a cigarette in your mouth or chewable tobacco material. You can use these as alternatives to get out of tobacco addiction.
A substitute for like a sort of oral fixation.
So
That is
you're
that.
engaged, probably your mind is diverted, and get into habits, good habits like exercising. Maybe you can have a different group to go on a walk or do something new.
A change in lifestyle.
Change in lifestyle.
Actively. How hazardous is tobacco smoking?
Yes, it's definitely hazardous. It's one of the preventable causes of lot of diseases, illnesses we have as humanity acquired it over time because of our lifestyle, like cancers, for example. I just told you there's so many cancers are linked directly to carcinogenic effect of tobacco, and heart issues, lung issues, blood disorders, chronic kidney diseases. So definitely one of the things you can prevent, many things you can prevent by quitting smoking.
Which cancers are related to tobacco in India specifically, and are there any other harmful effects of this beyond cancer?
In India, more than cigarette smoking, we come across people with poor socioeconomic strata chewing tobacco. There are various forms of tobacco which is available, like gutka, khaini, which people keep it under their cheek, people keep it under their tongue, etc. So they come to us with head and neck cancer, that is cancer of the mouth, oral cavity, cancer of the tongue, cancer of the palate. So food pipe, they are more in India compared to the Western world, where smoking tobacco is more common and incidence of lung cancer is more common. So apart from this cancer thing, tobacco, chewable tobacco, it also causes pre-malignant conditions like, oral mucosal fibrosis. There is reduced mouth opening, etc., which is because of long-term use of chewable tobacco material.
This is our last question for today. If a person quits smoking after years of being a chronic smoker, does it actually help or does it decrease the risk of cancer?
Yes, definitely. So there are multiple changes which happen when you quit smoking. First and foremost, your nicotine levels come down in the blood, and then your very toxic gas called as carbon monoxide, which is which gets into your blood because of smoking. Its level drop down in like 24 hours. Then your circulation, your lung functioning improves in a couple of months, and the risk of heart attack, etc., comes down by 50% at the end of say years. At the end of 5 years, I guess lung cancer risk comes down to 50%. So at the end of 10 years, the risk of other cancers like pancreatic cancer, etc., becomes half. So over time, once you quit after 10 to 15 years, your risk of getting a heart attack is just like your peer who is your age matched years. So that's how, quitting tobacco consumption reduces your risk of getting cancers.
It's almost proportional. Yeah. Thank you for joining us on Lungs First. Thank you to Dr. Mubarakunnisa Tonse for her valuable insights. Stay informed, stay healthy, and remember, every breath counts.